Welcome to another episode of Ask Your Doctors. We are still in the beautiful city of Durban, and need I say, where there is no load shedding. And guess what? Someone who's my partner in crime, our dynamite in small packages, decided to join us because she also ran away from the load shedding. Hi, Doc. How are you?
Hi, how are you?
I'm all right.
I'm good, thanks.
Welcome.
Good to be here. Good
Yeah,
to
how
be
does
here.
it feel?
I'm loving the weather.
Is
It's
it?
so much warmer compared to our cold city in Johannesburg. Yeah. So
Yeah,
I'm
thanks for
really glad.
joining us for our summer here.
It's good to be here. Thank you. Yeah.
Guess what? Few days of no load shedding.
It
Feels great.
feels great. A different lifetime, really. Yeah.
No, welcome. Thanks for joining us.
Thank you.
And we are discussing today pigmentation and vitiligo. Now, we are still fortunate to be joined yet again by another Dr. K, Dr. Nokubonga Khoza. It's Dr. K, and Dr. B. How are you, Doc? Welcome.
I'm good. Thank you very much for having me.
Thanks for
Thank
coming
you.
back.
Thank you. Thank you.
Clearly, we didn't anger you last
We
time.
didn't finish, yeah.
Yeah, and stay tuned because later on we will be joined by our guys from the neighborhood. We go to the streets and pick up what the population would like to know from their favorite specialists. Thank you very much. So, Doc,
Yes.
she's all yours.
So before we actually start the show, I actually have a very interesting fact while we're chit-chatting with Dr. K. So I'm very excited to have her here because she is somebody I look up to. She's my senior. We went to the same varsity together. So this gives us an opportunity to catch up, you know, get to know each other once again in professional spaces. So I'm really excited. Yeah.
Okay, I'm there. I could facilitate.
Thank you. Thank you. So as we introduced today's show, we were talking about hyperpigmentation and vitiligo. Maybe, Doc, you could please break it down to us. What is vitiligo for somebody who's wanting to know?
So vitiligo, whichever way you pronounce it.
Vitiligo.
Vitiligo. It's yeah, whichever way you pronounce it, depending where you are in the world, is actually a skin condition that leads to light patches or hypopigmentation, which is reduced color in the skin, or depigmentation, where there's complete absence of color in the skin. It's an autoimmune condition. So autoimmune, so something goes wrong in your immune system and your autoimmune cells or your immune cells decide to target your own body. And in the case of vitiligo, you have antibodies or immune cells that are targeting the skin cells, especially the skin cells called melanocytes, which are responsible for producing pigment. So when there's a war, there's between the immune system, you get complete destruction of these cells, and therefore they are unable to produce pigment.
Thank you. It sounds very interesting to understand the whole process. So you mentioned that it's almost like a war that, you know, the immune and the body and the skin cells are all attacking one another. But what exactly happens to the skin while this whole process is going on?
So it's actually, you know, vitiligo is one of the conditions where a person feels nothing. So we always say it's asymptomatic. So it's not like you experience pain or you experience itching. Absolutely none of that happens. You literally move from normal skin color and you wake up and you start having these light patches which spread over time. So which is why sometimes it's very, very difficult for patients to actually appreciate it or see it if it occurs in areas that are not exposed or the way they don't see it all the time, because it's a very, very silent condition.
Speaking of areas, Doc, what are the most common areas incidentally where it occurs?
So the commonest areas that you actually see vitiligo or where you get it, most of them are unexposed. So typically, you know, patients may have genital lesions. So whether it's involvement of the vulva or the penis, they may start having these light patches. As I said, they're asymptomatic. But in the visible areas, you'll see it on the lips, You'll see it at the fingertips or also on your toes, at the fingertips of your toes. But vitiligo can happen anywhere, so it can affect any area of your body, patches on the trunk, on the legs. But the commonest areas or the typical sites are fingertips, the mucosal areas, lips, and genital areas.
You already told us what triggers it. You said it's an immune reaction.
It's an autoimmune disease.
Okay.
Yeah, and just speaking, maybe if just to elaborate more on the autoimmunity, because you know, people may have a question about, is it related within the family? You know, does it affect more women, more men? Where do we actually see it in terms of that regard?
So the autoimmune part comes from, it's also very genetically linked. So vitiligo is a genetic condition. So you may have, you know, people with vitiligo saying that I have maybe a first degree or a second degree relative who may have had vitiligo. Sometimes I always say you may be the first one in your family, but that does not cancel out that it's a genetic condition. Yes, autoimmune diseases, we know that they travel in packs. So sometimes someone with vitiligo, especially if it's spreading a lot, we may decide to look more into the body and check, are there other autoimmune conditions that the patient may have, conditions like lupus, conditions like thyroid disease. Most patients actually may have thyroid abnormalities, so you may have subclinical thyroid problems, and then the skin will show these light patches. So sometimes we do look further. Conditions like pernicious anemia. So it is an autoimmune condition specifically for the skin, but you may also have it associated with other internal diseases.
Thank you, that's very interesting. Yeah.
Any reason why it's suspected to happen more in adulthood?
It is common in adults because probably we see adults more, but actually vitiligo affects children. The reason we may not appreciate it as much in children is because when it affects kids, they do really well. Most times in children, it's self-limiting and it repigments itself. And it's also it behaves better. If you treat it quickly in children, it resolves and they may not experience vitiligo later on in life. It's just that when we see it in adults, it tends to spread more and it tends to be more difficult to treat, and it's it has a poor kind of prognosis.
Brings us back to my next question. How quickly does it spread?
Very unpredictable condition.
Okay.
So it's one of those where we can't say that, we can't predict how quick it's going to spread. There are different types of vitiligo. So you could have what we call focal vitiligo, so it affects maybe one area of the skin, or you can have patches of vitiligo all over the body, which we call generalized. There is a type of vitiligo which we call segmental vitiligo. So when we say segmental, it will affect one side of the body. So you'll see lighter patches on the one side and they don't cross the midline. And it's one of the vitiligos where we can kind of have some, area of predicting it. We know that patients with segmental vitiligo will experience rapid spread of the condition within the first year. But after 1 year, it stops. So that is the only one. But generally, if patients are well and there are fewer patches, we can't tell unless when we do investigations and we find that there are markers in the body that are showing some sort of inflammation, then we may guess and say maybe we are going to experience more.
So now we are going to be talking about what are some of the causes that cause one to have darkening of the skin, or as we refer to as hyperpigmentation.
Yes, lots of skin problems or skin conditions that will cause the skin to go dark. So, and the reason for that is that especially in black skin or darker skin tones, anything that traumatizes the skin will leave a black mark or a dark mark. It's one of the reasons why patients come and see us, and it's one of my probably top 1 or top 3 conditions that I treat in the practice. So commonly, I think the most common cause of hyperpigmentation is what we call post-inflammatory hyper. So there was an inflammatory condition and that now it has left marks. And the commonest condition is acne. So we spoke about acne scarring in one of the episodes. And one of the first signs of scars in acne individual is the change in skin color. So, but you can also have post-inflammatory hyperpigmentation from conditions like eczema. So you can have a rash and it heals with a dark spot. Conditions like psoriasis, even fungal infections. People can have a ringworm and then it heals with a dark mark. So that big category of post-inflammatory hyperpigmentation can be anything and everything, long-lasting, and really affects people's quality of life. And then you can have hormonal changes. I think the most commonest condition is what we call melasma. Some people call it amashibaba. That's not the correct term. Or basically the pigment that you see on the cheeks, mostly in women, but we do get men that get melasma, and that is usually related to hormonal changes, whether it's pregnancy, whether it's using oral contraception, whether it's menopause or postmenopause. Usually women will tell you that I had a hormonal episode, the ones that I've mentioned, and then I got pigmentation on my face. But a big category that I see now of hyperpigmentation, and I always speak about it because people dismiss it or they may not know it, is a condition called lichen planus. So lichen planus can affect the skin, but especially black people, and cause absolutely no symptom, nothing. And so usually the patient will say, I am progressively getting dark, and sometimes the darkness will be on the neck and it will also be on the face, but it's a very, very slow process. And the reason we want to highlight this condition called lichen planopigmentosis is because most of the time you may see the pigment change. It's very dull, it's very far, but usually these women may experience scarring or permanent hair loss. And so it's a very, very early sign for us to pick up and then be able to, address and prevent them from losing hair. So you'll see it on the neck, on the face, it's almost gray, and sometimes on the tip of the ears. But we also take a lot of medications, and the commonest ones are blood pressure medication, joint or arthritis medication, even antibiotics, that when you take, there is some interaction between the drug itself and the sun, and that causes pigmentation problems, especially on sun exposed areas. So you can go dark on the neck, on the face, on the arms. And we see this a lot again in patients that are HIV positive, that have just started the antiretroviral agents. The sun burns us, black people and everybody else. And one of the biggest category that causes pigmentation is what we call photoaging. And in black patients or black people, photoaging comes out as hyperpigmentation.
That's very interesting, and I hope people really do take that home. And there's a lot of emphasis, obviously, on women, because obviously we're always worried about our skin.
Not that men don't pigment,
yes,
but they do.
do.
I see lots of men. They may not take note, not that they don't take note, but they may not put it as a priority.
So, Doc, let's talk about microneedling, because it's very popular nowadays as an alternative, or maybe as a treatment option for dealing with hyperpigmentation.
So microneedling is a procedure that we do in our practices. It's almost borrowing from science, or how the skin heals itself. So we use these devices that allow us to produce controlled injury on the skin. So we injure the skin with the hope and with knowing that the skin will heal itself. And when the skin heals itself, it brings, to the skin very important skin cells like collagen that build up the skin, melanocytes that are important for kind of healing. But we can also use microneedling to treat hyperpigmentation, but strategically. So we can do a lot of things with these devices. We can treat acne scars, we can treat hyperpigmentation, we can treat conditions like vitiligo sometimes, because we traumatize the skin, and we know if we traumatize the skin is going to respond and bring in melanocytes to the skin for healing, and in doing that maybe bring the pigment in, so that helps with vitiligo. But commonly it's for rejuvenation, anti-aging, treating of scars. And when we're using it for hyperpigmentation, we're using it because when you drill these holes into the skin, you actually create channels, and then it allows us to put in products that we know when they penetrate are going to lighten the skin. It's not my first line treatment for hyperpigmentation. It's actually very last on the list, and it's something that we do when we have treated, or identified the cause of the hyperpigmentation, and we've treated the hyperpigmentation sort of medically, as well as using skincare products, and then we say, how are we going to boost you know, is there anything that we can do to boost penetration of skincare products, then we use microneedling.
Thank you for actually clarifying the role of, microneedling. One would think, okay, you're causing trauma. Does that counter, is it not counterintuitive to what you're trying to avoid with hyperpigmentation? But thank you for the clarity. So you mentioned that it's your last option. What other options may there be for treatment of hyperpigmentation?
So the most important thing is to actually identify the cause of why the skin is producing pigment excessively, and then once you do that, you go in and you treat that condition or whatever directly. But general things, the first thing that I always say when you have excess pigment is use sun protection. So sunscreen use is actually a treatment when we're dealing with hyperpigmentation disorders. And then secondly, you want to use products that are going to reduce pigment production, and these are products that may have ingredients like retinol, ingredients like salicylic acid or alpha hydroxy acid, something that we call kojic acid, azelaic acid, or vitamin C. You also want to use products that are going to exfoliate the skin, because when you exfoliate the skin cells come off with the pigment. And then lastly, all of these things can be very harsh. And remember, the skin has something called the skin barrier. So you want to use moisturizing ingredients that are going to repair the skin barrier so that you don't get further injury from these harsh products that you're trying to do.
Just taking you back a step ago to microneedling, Doc. What are the chances of scarring in that instance?
Lots of scars. If it's used one for the wrong condition, if it's used inappropriately with unexperienced hand, remember we're causing trauma. So especially in dark individuals, you can actually cause more hyperpigmentation, and we see it. It's almost like these trail lines where the needle has gone, and if it's not used correctly, you can actually introduce infections and get skin infections. And sometimes people don't know what products they should be using to glide onto the skin. There's been cases of individuals who've used vitamin C, non-research vitamin C on the skin, and then they get granulomas, these foreign bodies that actually granulomas in the skin. So there's lots of complications, but mainly scarring, pigment infections are the main ones.
So we took it to the streets, Doc, to really get a sense of what the people think and what questions they had regarding the topic. And this is what they had to say.
Hi, my name is Maruma. I have a question. If we do not use sunscreen as black people, are there any sicknesses related to the lack of not using sunscreen? I'd like to know. Thank you.
Doctor, I want to asking you, lento ebiza ngeVitiligo yini ekhoza ukuthi umuntu abe ebusweni abe blue, like isikhumba sakhe singabe right? Bengicela ukubuza ukuthi why kube njalo umuntu abantu abaningi most yabo babe naleyo nkinga yini icause yayo?
So doctor, tell me, what causes vitiligo? And can it be treated? Can my skin go back to normal?
Okay, doctor, what I want to know from you is that can you reverse the condition of vitiligo?
Okay, thank you guys. Welcome back. It's still Dr. K, and Dr. B. Now, Doc, ubazwile abantu bayabuza, bati, the dark patch around the eye. What is that?
So it depends. Dark patches around the eyes are common, and most of the time though they affect both eyes. It's very common for people coming to say, can you help me with treat dark circles around the eye? There's many causes of that, but if you're having a dark patch on one side of the eye, the commonest thing that I can think of is a birthmark. Now, not all birthmarks are going to appear when you are born. some actually appear as you age. And there's a condition that we call a nevus of Ota, which is excess pigment, blue-black pigment around the eye. And that's commonly the one that we see affecting one side of the eye. So sometimes though, a periorbital hyperpigmentation can be caused by other things like allergies, especially eczema, anemia, yeah, most of the time it's actually allergies. Lots of conditions, but I can only think of those two.
One of our other questions from the street says, could neglecting sunscreen actually predispose you to vitiligo?
No evidence to suggest the fact that not using sunscreen causes vitiligo, but sunscreen use during or when you have vitiligo is very, very important for protection of the skin from the harmful effects of ultraviolet light A as well as ultraviolet light B.
Yet another question on sunscreen, is it even necessary in winter?
Sunscreen should be used by everybody, irrespective of skin color, skin tone, 365 days a year, winter, summer, spring, autumn. The reason why we stress the use of sunscreens in winter is because there are many light rays. There's ultraviolet light A, there's ultraviolet B, there's visible light. All of them contribute to photoaging, darkening of the skin in black people, as well as skin cancers in the lighter skin tones. Now, ultraviolet light A, 80% of it can penetrate the clouds, the glass, and it's the one that actually causes more and more damage and more deeper penetration into the skin. So we apply sunscreens all year round, especially in winter.
And can we reverse vitiligo? The people want to know.
Vitiligo is treatable. So yes, you can have light patches, and if you address it early, we can treat and you can have the color coming back.
Thank you, Doc. I think abantu bakuzwile. Now we would like to go viral while we have the two doctors, one about the skin and one about viruses. Dr. Mashishi, please tell us, chickenpox, how does that differ from monkeypox?
Yeah, it's quite an interesting and very important question that people should understand. Firstly, even though both viruses end with pox, they are completely unrelated. I think that's important for people to understand. They don't belong to the same family. And also in terms of how they present is slightly different. Typically, there's the rash in monkeypox and the rash that you see with chickenpox are not the same. With chickenpox, it's usually itchy, and the rash is almost like blisters and pimples. Some are healing, some are not, all together at one time. With monkeypox, you don't typically see that. You see a pimple at a time that moves to a very regular pattern, if I can say that. So it'll move from like a pimple to a blister, and then it will start healing. And then also with monkeypox, you can have it in the hands and the feet that you don't typically see with chickenpox. But obviously in this time now, monkeypox is not presenting in that typical way as we would hope to see. So the best way really to differentiate the two viruses is to test for the difference. Yeah.
And for that, you do a blood test, or you test the...
We actually test the actual pimple, if I can say that, the blister. You take that and we test for which virus that's the best test that we can do.
Which one transmits more potently?
Chickenpox is more transmissible, given the fact that it's actually airborne. So it's airborne over and above the fact that you need close contact to transmit it. Monkeypox, although it can be, it's more close contact that we see the virus actually moving from person to person.
And the comment that was made about how monkeypox transmits in gay men, that didn't sit well with many people, because having a country that's got a lot of stigma for many different incorrect reasons, what is your professional medical take on it?
Yeah.
Is there evidence for such?
I think it's incorrect to say that it affects gay men. Monkeypox can affect everyone, independent of gender and age or race. And I think people should remember it. It just so happens that there's been a lot of focus on men who have sex with men. And remember, men who have sex with men includes gay men and straight men who choose to have partners with other men.
Thank you, Doc. There you have it, guys. See you after the ad break. But you confuse me.
So we go. So I'm just gonna take it from where she left off.
Yeah.
Okay.
Stand by.
I apologize.
Okay.
And in 3, 2. Call it, please.
I don't remember where that. Oh, questions.
Call it,
Sorry.
please.
Yes. All right. No, it's because okay. Cool. Sorry. Ask your doctors. Going to the streets, coming back from the streets. Episode 31, camera 1, 2, and 3.
You want to?
It's quite a bit to absorb, but I'm afraid we need to take a break.
Yes.
We'll see you after the break.
Okay.
Now, welcome back. Thanks for sticking around. Dr. Khoza, tell us, Dr. Bonolo spoke about monkeypox, chickenpox. Now, there's lots of lesions associated with these two viral infections, and there's obviously scarring and damage to tissues. Please give us light at the end of the tunnel. Can we treat some of it at least?
Yes, definitely. And when it comes to treating viral infections and the scars that actually result from them, timing is everything. You want to treat these conditions early on, within the first 72 hours, before they actually destroy the skin and leave these pitted scars that we see. And let's say then that the scarring has already occurred. As I said, I mean, there's various ways that you can treat scars. In fact, microneedling that we spoke about is one of the tools that we use when we're treating scars from chickenpox. But we need to make sure that the virus is completely settled and we've treated the viral phase of the condition completely. The skin has healed, so you don't do it in the first 6 weeks of having an episode. And the reason we love microneedling because we're trying to stimulate the dermis to produce more collagen, but also we're going to be able to infuse some of the lightening agents that will take care of the scars.
Okay. Now, the interesting part of the episode is where we talk about myths and you give us tips. Let's start with the myths.
Yes.
Let me introduce one myth. You can introduce another. I'm sure you got a lot of voodoo stories by your side.
Yeah.
Now, it says here that vitiligo is contagious. What can you do?
So, and that's a common one, a common belief. But it's false because we said that vitiligo is an autoimmune condition. So it's not an infective condition. It's only infective conditions that tend to be, contagious. So vitiligo is genetic. It's issues with your immune system, but it's not an infection that actually triggers the immune system, and you can't pass it on to other family members.
And as Africans, we have ancestral beliefs, obviously. So one common belief also is that you get vitiligo because you're not answering to your ancestors and they're potentially angry with you for not answering their call.
Yeah. And that's appropriate being in KwaZulu. But remember, vitiligo affects everybody. It affects whites, Indians, blacks, who may not have the strong belief of ancestors. So definitely not true. Sometimes I have heard though that sometimes when you see clusters of individuals that say, let's say, belong to one family, we said that it can be a genetic, so you may have other family members. And I think sometimes the belief comes from that, where you see isolated families who may have depigmented skin lesions. The belief may be that families curse. But we want to get away and actually, debunk those myths. It's not related to any ancestral belief. It's purely an immunological disease, genetic, driven by autoimmunity.
By the immunity.
Okay.
Thanks, Doc.
And another myth, obviously, we all now, after this episode, have been informed that it is not a sign of serious illness. Yes, Doc, before we let you go, please tell us where our audience can find you.
So I'm in Durban at eThekwini Hospital and Heart Center, but you can also find me on socials, on Instagram, my name, DrNokubonga Khoza Derm, Facebook, DrNokubonga Khoza Dermatologist, or you can visit my website, which is www.durbanskindoctor.co.za.
Awesome. And you can also find her on our website under the tab that says Find a Doctor, and that is where you will find every other practitioner, specialist, and guest that has been on our show.
Well, that's all from us today. Thank you, Dr. K. Thank you, Dr. K. It was really informative to have you on the show. Until next time, this is Ask Your Doctor. Keep asking your doctors.